Welcome everybody, and thank you for taking the time. We'll let everybody slowly trickle in. I know even in a virtual conference, we always want to give people a couple more minutes. Again, thank you for joining today. I will ask one question. Can everybody see the PowerPoint slide? Yes, okay, perfect.
Yes.
You never quite know about whether or not what's being shared on Zoom. So I'll go ahead and start. And so again, this I wanted to make as interactive as possible. So the main thing is to please basically feel free to ask any questions throughout the presentation. Again, I don't want this to feel like we're back in school again, but instead just an opportunity to really have a conversation. And so again, my name is Jessica Nunan. I am the co-CEO of Caminar Latino-Latinos United for Peace and Equity. We are based in Atlanta, and then we also have a national arm, Latinos United for Peace and Equity. I know we don't have a ton of time, but just so we get a better idea, we'll go ahead, we'll go around real quick and basically just name who you're with and what you were hoping to get out of coming to this breakout session versus any of the others. So Catalina, I apologize, but unfortunately you are the first person who is in my box. And so Catalina, would you like to start? Nunez? I think she's busy. Would anybody like to start or be the first one to introduce themselves?
I will. My name is Elizabeth Duran. I'm the clinical director at Enlace Comunitario. We're a domestic violence agency out of Albuquerque. And I am interested in this session because, again, it's in the Latino population, and to see what, again, approaches or how your point of view on how Latinos use violence for power and control.
Thank you. And who would like to go next? Thank you, Elizabeth.
Good morning. My name is Pat Acosta. I am with Camino Nuevo here in Las Cruces. The reason I joined this session is I've been doing a lot of work in the barrios and in the community, and I'm always interested to hear different perspectives and similarities. So I look forward to learning.
Thank you.
Good afternoon. My name is Gene Johnson. I'm calling from New York City. I work for the Center for Court Innovation, a pre-trial program that is based in our supervised release program, which is an alternative to cash bail. We do a 3-hour intervention program for IPV. I think what I'm looking to possibly get out of this session is get a better handle on the different cultures in the Latino. Here in the city, we have Puerto Ricans, we have Dominicans, we have all sorts of across the Latinx Hispanic community. They even speak different languages, obviously Spanish, but different, I guess, dialects, if you will, of Spanish, and have different cultures depending on where they're from. So just interested in learning more. Thank you.
Thank you. Paul, I saw your hand up.
Yes, hi, Paul Bellenboyer, founder and facilitator in Peaceful Families for a Healthier Jersey City. You can guess where I'm located. And I'm here principally because I think that community engaged work is a growth area for our field. I'd like to learn more about how you do it, chiefly because it seems to work better for the folks who are in our program, but it also helps address some of the greater needs for working in systems and society that Etienne Alderando referenced in our earlier keynote.
Thank you. Who would like to go next? And for anybody who may just be joining, it's name who you are or who you're with and the reason why you chose this breakout session. Amanda?
Hi, my name is Amanda Leal, and I am with Center of Protective Environment in Alamogordo, New Mexico. And I would hope to gain just more of a cultural sensitivity in my groups and my community. We have a higher percentage of Latin individuals in our groups, and I think it's important for me to challenge myself in this area, and wanted to make sure that I can become more culturally sensitive. So thank you.
I'm happy to go next. I'm Karen Wyman. I'm the Prevention and Intervention Director at the Maine Coalition to End Domestic Violence. And I'm here for a lot of the same reasons other folks have mentioned. I'm really thinking about like how we can respond to the specific cultural backgrounds and needs of folks here in Maine. Thanks.
My name is Juan Martinez. I'm with the Sandoval County DWI Prevention Program in Bernalillo, New Mexico. And mostly the reason why I did this breakout session is being a Latino myself, always looking forward to have more resources to help better suit the community, and always looking eager to learn about something that potentially I don't know in myself. So I'm excited to get this going.
Thank you, Juan.
My name is Trisha Ladue. I'm with a Director of Violence No More in Maine. And actually, I was originally signed up for another piece, and then I heard Jessica speak, and I actually was like, this sounds really like something I'm very interested in. So I switched over. Thank you.
Thank you, Trisha. And I know that we haven't finished there, but thank you, because I was like, did I make a mistake about not sharing the PowerPoint earlier? So thank you. I'm glad that whatever I happened to say in the first session, I've rung true for somebody. So thank you.
I can go. My name is Diane Rockledge. I work at the Texas Council on Family Violence, and we support programs, domestic violence centers, and abuse intervention programs across Texas. So we're always trying to look for ways to better support culturally appropriate and culturally responsive services for our program. So I'm really interested in your session today, Jessica.
Thank you.
I can go next. I'm Nathan Fuhr. I'm with the New Mexico Crime Victims Reparation Commission. I just like to learn more about culturally competent program designs, culturally appropriate programs, and that's kind of what drew me into entering this session today.
Thank you.
Okay, I guess I'll give it a shot. Unfortunately, my county issued laptop does not allow me to do a video now. So my name is Mitchell Batiste. I'm from Chicago, Cook County's Social Service Department, which is actually the Misdemeanor Probation Department of Cook County. And I'm also the facilitator for the Domestic Violence Program. And I was just interested to see how things go in, in other areas. We have a nice Hispanic population, mostly Puerto Rican and Mexican, but we're starting to see a few Dominican and Colombian population. So just trying to figure out how everything goes when it comes to just trying to address everything that we can when it comes to domestic violence.
Perfect. Thank you, Mitchell. And then who has not gone yet?
I have not. I can go next. I do apologize. I had to turn off my camera because it's just cutting in and out too much with the internet. So good morning. I'm Catalina Nunez. I am the Clinical Director for Valencia Shelter Services in Los Lunas, New Mexico. I joined this because we do have a pretty large Hispanic population here, and just kind of trying to incorporate as much as I can of the culture and everything from other Latinos, and just seeing what more I can learn. Thank you.
Thank you.
I can go. I'm Iris. I'm actually a staff member with the coalition here in New Mexico. So I'm mainly here as support to you, Jessica. I'll be keeping an eye on the chat for questions that come in and if anything comes up along the way, but I'm really glad that I get to be a part of this session, and it's really great to see all of you here. So thank you so much for coming.
I can go next. Can you hear me?
Yes.
Oh, great. Thank you. This is Sarah Huser, and I am with the Michigan Domestic and Sexual Violence Prevention and Treatment Board, which is in the Department of Health and Human Services. And I'm in an exploratory phase. We really have a lot of work to do with battery intervention programs here in Michigan, and improving and creating more, working on our standards, et cetera. We just have a lot of work to do. And I really loved your presentation, Jessica. And I think culturally specific battering intervention programs, I think, seem to me like ahead of the game. And I'm really interested in learning more about any culturally specific serving program, so that we can do the best job we can here in Michigan. So I'm looking forward to your talk today. Thank you.
Thank you. Have we gotten everybody? I want to make sure we don't miss anybody. Okay, well, again, thank you everybody for taking the time. And for some of you all, I know your organizations well. And so it's great to be able to meet new team members from CCI, the Texas Coalition, from Enlace. So it is great. And then to the agencies that I have not worked with before, welcome, welcome. And so again, this is more interactive versus me giving a presentation. And so please feel free to raise your hand, speak up if you have any questions, comments, concerns, anything like that. Okay, so okay, and of course we're going to go ahead and start having technical difficulty now. So basically, let me go ahead and start this again. And of course, this always happens anytime. Go up there. I'm going to go ahead and share my screen one more time. Okay, are we back to basically the screen that I was supposed to be on?
Yes.
There we go. Okay, thank you. So basically the mission at Caminar Latino-Latinos United for Peace and Equity, but because we have a very, very, very ridiculously long name, we call our national arm LUPE. And our mission is to create opportunities for Latino families to transform their lives and communities. And we work to change the social conditions that give rise to violence. And so again, this is a pretty big mission. And so what we always tell people is that we utilize a three-pronged approach and being able to create sustainable change in addressing the issue of family violence. Because for all of us, I'm sure in this room, we know that domestic violence, family violence, there are a lot of different terms for it, that it's not just an individual or family level, that changes need to be made on several different levels in order to create sustainable change. So our family initiative programming, which is what I'm going to be focusing on today, what that covers is basically our comprehensive programming for Latino families impacted by violence. And so what that includes is basically, again, we have 4 different groups for survivors, including one for male survivors. We also have a newer group called the Next Generation group, which is more for kind of the younger survivors. And then we also have 2 other groups. We also have 2 what here in Georgia is called family violence intervention programs around the nation, sometimes called BIP, APIP. So, and we have one for males and one for females. And then we also have 5 age-specific youth sharing groups for, again, youth who've been exposed to violence. And so with the exception of our EPIP program, which we offer on the sliding scale, everything else is free. And there's also no kind of time limit. And so basically, I've had the honor of being involved with the organization for over 25 years. And so there are some families I've known for 10, 15 years that just really kind of come. So it goes back to that community portion of it. In addition to our weekly intervention prevention groups, we do kind of like the standard services that most domestic violence programs do. So again, we have parenting, advocacy, crisis intervention, information referrals. So what we really see as our role is to provide, utilize a holistic approach, understanding the fact that domestic violence is not the only issue that is going on with a lot of our families. And sometimes it can be issue 9 or 10. And so when the families come, we really try and start with what they need and really kind of going down the list. Because again, if we only focus on the family violence, it's not taking into account if they're having financial issues, educational issues, anything like that. Our community initiative programming, that was created, and that basically covers our leadership programming for both survivors of violence who have gone through a program and are now at a point where they really want to utilize their experiences, the knowledge that they've gained over the years, as well as their own expertise, in a way to really increase the capacity and awareness within the community. And so even though I am Latina, what I always like to say is that I look and sound white. And so as a result, it makes a big difference for if I were to go out in the community talking about domestic violence versus somebody who whose first language may have been Spanish, who may be able to better associate, because I understand that my experiences and again, the way I sound and look does have an impact in terms of basically the way in which participants or the community may be able to relate. And so we really started our leadership programming with the idea that community members are better able to connect, are much more willing to listen when it's coming from their own community members. And so we did the same thing with also our youth leadership programming. And the idea was to take the lessons and what the youth had also learned and their own expertise and be able to share it with the community. And so this included also providing the opportunity for youth to do their own research about how violence had impacted them and how law enforcement, Department of Family and Children Services or Child Protective Services had responded and recommendations for them. So again, us being a Latino organization, this involved the youth really stressing the importance of not using them as interpreters and making sure that law enforcement was aware about basically the dangers of using them as interpreters. Finally, our national arm, Latinos United for Peace and Equity, that started back in 2018. And this was basically, again, based on our realization that we knew for a fact that changes needed to happen on a systemic level. And it wasn't just for our community, but realizing kind of the way in which the judicial system was set up and a lot of different things, and a lot of the responsibility was being put on survivors. And so changes needed to be made on the systems level, again, to create the sustainable change, instead of always looking at this as a responsibility of the survivor or sometimes an individual who used violence. And so what we have always said is that we have more values than this, but what we have always said is that we really and truly have let our values or our guiding principles guide our work. And so for any of you all who basically work in nonprofits, you know that they always recommend strategic plans. And so the strategic plan is basically the idea about you're supposed to know within the next 3 to 5 years about what you're going to be doing and do this needs assessment and all this other kind of stuff. Well, in reality, a lot of our programs were never based on strategic plans. It was always based on what we saw as a need, and again, listening to the voices of the survivors. And so going back to how we first started, the idea of safety. And so when we first started, again, we saw it as safety as if the partners left their abusive partner, then they would be safer. And what we quickly realized is that that was not accurate, because what happened, for example, to an immigrant, undocumented Latina, if she left her partner? Well, because of her documentation status, she didn't have access to basically long-term housing. She also had limited options in terms of financial assistance. And so all of a sudden she left her abusive partner. There went the opportunity to have a roof over her head, over the children's head, as well as food. And so what we found is that this could actually put the survivor in the more dangerous position. We also know for a fact that, as we know, the average amount of times it takes is about 7 times before somebody leaves. And so what we found is that for the women, they felt safer not only participating in our program itself, but also provide the opportunity for their partners. Because once their partners started learning about family violence, and once they started learning about different alternatives when dealing with conflict, it helped to increase their safety. So again, it wasn't just basically like, hey, we see a need, but we also saw it how everything really went together. The idea about being community driven. So in the earlier session, one of the things that both myself and one of the other presenters have mentioned is that we don't say that we use a model. And so I know that a couple people here have mentioned in terms of learning more about working with Latinos. And so I want to make this clear. In Atlanta, it's not a multi-generational presence for the Latino community. It's a newer community. Back in the 1990s, due to the Olympics, was when Atlanta really received the first influx of Latino immigrants. And so at that time, basically, the majority were from Mexico. And originally it was basically younger males, and then they would bring over their families. And so what has ended up happening is that our program, again, was built based on the needs of the specific Latino community that we were working with. So again, it was immigrant and it was mainly Mexican. And then about 32 years later, what we're seeing is that now we're dealing with a first generation, and also, for instance, Spanish not being the preferred language in some instances. So again, our next gen group, as we call it for the support group, we say that the primary language is Spanglish, because a lot of the participants grew up here in the States or basically moved here when they were very young. So they feel more comfortable speaking in English or Spanglish, which is kind of the combination. So when the program was built, and again, it was not based on a strategic plan at all. Again, it was kind of looking to see about what was needed and then seeing our role to help kind of fulfill what the survivors felt like they needed. And so we always listened to the voices, and they were really the ones who built the program. In addition, Julia Perilla, who I heard at the ONI also reference her. So she was a clinical community psychologist, and she was one of our co-founders. And so she, although she had letters behind her name, she really was a big advocate for recognizing the value and really seeing the need for a place for everybody at the table. And so she was really central in terms of when the state of Georgia went through those process of certifying and monitoring family violence intervention programs. At first, they were planning on making a requirement that all facilitators had letters behind their name, whether it be a counselor, therapist, whoever it may be. And so even though, again, she had a PhD, instead of utilizing it in a way for her to kind of be seen as an expert when working with individuals who use violence, instead, she used those letters behind her name in order to really change the certification requirements for facilitators, and being able to use that privilege and the fact that she was in the room in order to ensure that people recognize the value of participants being able to really connect with whoever those facilitators were. And so that was how she made it possible for, again, 2 of our previous participants to be facilitators themselves, because although they didn't have the letters behind their name, their ability to connect and relate to the participants made a huge difference. finally, in terms of integrity, for anybody who's worked with individuals who use violence, it's very tempting, and especially if you're also working with the survivors and or their children, it is very tempting to basically look at them and treat them like they're horrendous, because you hear about the violence, you hear about everything that they're going through or that they've put people through. And so it's kind of easy to say they aren't worth anything, let's just kind of push them off to the side. Well, this wasn't realistic in a lot of different ways, because even when the mom and dad, for instance, wouldn't stay together, this was still the father of the children. And so they were still going to have a role in the life. And what we found, again, because we have the opportunity to work with each part of the family, is that while there were some really bad aspects in terms of their use of violence, we also found that these were the same people who would do anything to provide for their kids, to make sure that the bills were paid, anything else. And so our commitment to understanding that our EFIP participants were more than just their use of violence made a huge difference in terms of the way that they felt comfortable, that they felt accepted. And I just want to stop here and see if anybody had any questions, comments, concerns. No. Okay. So what do we mean in terms of a culturally specific approach? So this you see in a lot of different ways in terms of our work. So again, I've already talked about our comprehensive approach. For the Latino culture, and again, this is not only related to our culture, but in the Latino culture, family is central. And so what we found is that what made the most sense for us, and again, going based on the recommendations of the survivors, it made sense to have one program that offered programming for each part of the family. And again, providing the opportunity for the families to come to one place at the same time and each receive the intervention prevention services that they needed. It made sense in terms of us also being able to have a much clearer idea about what was going on. And so what this also allowed us to do is that the team, we would have the advocates working with the survivors or the children. Then we would have our EFIP facilitators who would be working with our EFIP participants. And then we would get together and we would have a much clearer idea in terms of, okay, this is what, our EFIP participant is reporting in group. What is his partner saying? Or what are the children saying? And so it allowed us a much greater idea or much clearer idea about what realistically was going on. At the same time, we have always been very careful in terms of not revealing specific information. So for example, if basically the partner was saying stuff in terms of, hey, listen, he has stopped being physically abusive, but he still has no or he still won't allow me access to our bank account, or he still controls all the money or anything like that. And we heard this as a kind of an ongoing theme from a few of our participants. What we would do then is that our EFIP facilitators would then incorporate that into group like a couple of weeks later. So it just looked like a topic. And so we were able to really see about what was impacting the survivors and be able to really incorporate it. So what was being discussed in the previous session about using the curriculum as a guide, but realizing the fact that you also have to make it relevant and really stay in tune to what is going on with the specific community members that you're working with. Again, I won't go into the skills and requirements. You guys have already heard me talk about this, but again, really being able to have these different perspectives and having that multidisciplinary approach really does make a big difference in terms of being able to offer the best support and intervention to these families. Another thing that brought about concern was how aren't you putting the survivors in danger? Because you're having the support groups going at the same time as the EFIP groups. And so I would say that this would not have been possible. Our program approach would not have been possible without our partnership with the faith community. So I want to make this very clear. We are not a faith-based organization. At the same time, again, recognizing the role of faith within the Latino community, we realized that by partnering with them, that we were seen very differently. So for example, in all our years, we've always had our groups take place in a church. Because what we found is that no matter how violent the men were, they weren't going to be violent in God's house. And so that really made a difference. Also, when the men would first come up to group for the first time, instead of it being a government building, instead of it feeling like, okay, here is basically, again, the judicial system, a government entity or anything like that, instead they walked up to a church. And we've never had clergy members basically be the ones to facilitate. There was never like a blessing at the beginning or anything like that. But just as having the church as our community site location basically sent the message to our participants that this is where, or that we had the support from the faith community. And that really made a difference in terms of the way in which we were viewed. Finally, for those survivors whose partners didn't know that they were coming, so I also want to make this clear. We do not require all parts of the family to attend. It's really whoever wants to. So we work with a lot more survivors than EFIT participants or anything like that. But what we found is that for survivors whose partners didn't know that they were coming to the program, when their partners asked about where they were going, they could say church. And if they were followed to church. And so these were all little things that really made a big difference in terms of the safety and the well-being, and again, the way in which we were received and perceived by our EFIT participants. The curriculum that we utilized, it was developed by a Latino psychologist. It's called SysVim. And so again, the curriculum was based on the specific needs and realities of Latino males. And so that is not to say that the LUPE model or other models don't really work or anything like that. But again, having something that really was based on the needs of the Latino community made a big difference. And so what we found is that, again, we use this as a guide, but because it's open enrollment, we constantly have people coming in and out. And so there is a level of flexibility. We, in addition to kind of like the different exercises that would happen, there would also be what we call the education component. And so with the education component, it was stuff in terms of the use of alcohol or drugs. If we found out that somebody was an alcoholic or had a drug addiction, this was not a good fit. So we would always make sure that they got that help first and then came to our program. But the education component was more focused on, I'm sure we've all heard in previous times, like, oh, I did this because I was drunk. And oh, she made me do it and I was just so angry and I couldn't control or anything like that. And so really and truly offering the opportunity to learn about the role of alcohol or drugs and the use of violence, for example, but also, again, going back to accountability. If you know, for instance, that you become more violent when you're drinking, then you know what? Don't drink. And so it's stuff like that. It's not discounting. It's not saying, okay, we don't believe you that basically was the alcohol. It's basically, again, putting that choice with the EFIT participants, making it very clear, and also us being very careful that we're not telling the alcoholic, like, just don't drink. And that's why, again, we would make sure that they receive, like, going to AA or receive whatever intervention and support that they needed before enrolling in our program, because of the fact that addiction is a disease. Community feedback. This has always been big for us. And I think that this is at how basically we have gotten thick skin over the years is because it's one of those where we always have to continue evolving, and we always have to continue to see about it how we can improve our services and what makes sense and what doesn't make sense. And so again, the program started based on the feedback that we were getting from the survivors, but we have continued to evolve. So a couple of examples is that we noticed, for example, that we were getting survivors mandated to our EFIT program. We have a female EFIT program. And so again, I want to make this clear. I am not saying that women do not use violence. It's not that at all. But what we found in a lot of the situations is that we that they would be arrested for basically defending themselves. But from the judge's perspective, for whatever reasons, they would still be mandated to attend the EFIT program. And so what we did is that we arranged it where they were able to fulfill the court mandate while also addressing, if they were using violence. Because again, there are situations where we did find survivors using violence, either against their children or their partner or something like that. But also we set up in a way where they were able to not only go to their EFIT program, but then also receive support services as a survivor. So we made sure that they were able to fulfill, but also being realistic and looking at the whole entire situation versus just looking at what they were mandated to attend. I would say about 7 years ago, we also started realizing that Atlanta has a large, it's probably not, but we have definitely a presence of the LGBTQ community. At the same time, while there are resources for the LGBTQ community, they were mainstream. And they, again, were being built, or they were being based on the needs of mainly white members of the LGBTQ community. And so what we started realizing is that there were survivors as well as individuals who use violence who are having to choose between programs that address the aspect of their sexuality or programs that address culture. And so what we found was that because there's so much intersectionality, that it made sense that we basically really increased and improved our programming for the LGBTQ community. And so that was seen about, what was the best way in terms of meeting the needs, differences, and really kind of looking, and that was what again led us to our male survivor group. And so before I go on, any questions, comments? No? Okay. So what I have found is basically the biggest thing is listening to the community and especially survivors. So I keep on saying this over and over and over again. And this really makes such a big difference. I think also it's really seeing the reality and looking at the whole entire person. So for example, again, we are always looking to increase the safety and well-being of survivors and their families. At the same time, we also are going to be treating our EFIT participants with respect and recognizing that for the majority of them, they're a lot more than their use of violence. And so even in terms of when we have looked at our protocols and our policies, so here in Atlanta, one of the things is that they are required to basically surrender any firearms that they have. That makes sense. Domestic violence, you want to do that. At the same time, looking at the reality, again, if you're talking about, and I know this probably won't be a shock, Atlanta's not immigrant friendly overall. We're slightly improving, but again, we're in the South. And so if we were to be asking a Latino undocumented male to go surrender a firearm, so please go into a police station where you're not documented, where you may or may not have language problems or language access problems, and go ahead and say that you have been charged with domestic violence and that you have a firearm. That's a very scary situation. And that's one which we can't guarantee about what would happen. And so we made sure to come up with a protocol that that helped to ensure the safety, where we were able to come up with one place that the men were able to surrender any firearms, where we had a relationship and we can ensure that they wouldn't be asked for documentation, that they wouldn't be arrested for other stuff at the same time. So again, really looking at the overall situation and making sure that the participants didn't get punished while they were trying to fulfill court mandates. Paul, you had a question? The joys of technology.
There we go. So yes, so listening to your community, could you talk a little bit more about how you make sure that happens for your whole organization? So I imagine that it's something that everyone is responsible for, but in other words, how do you listen through the facilitators? How do you listen through your participants, through victims? And then how do you take the results of that listening and translate it into what you do in response to that?
So I think that, again, it's something in which we really try to ingrain. It goes back to kind of our guiding principles and values. And so our volunteers, as well as our team members, from the very beginning, our core values are shared with them and how that works out in real life. And so one of the things is that we kind of joke around at times and tell people that they're going to have to be very humble to work with us in a way, because of the fact that they're not going to be seen as an expert. They're not going to be seen as in charge. And so as a result, it's one of those where really trying to stay in tune to what they're saying. I think in addition, it's one of those where, for instance, when we were looking at different funding opportunities, one of the things that we were looking at was transitional housing. We're like, oh, that makes sense. So it's going to be another one. But again, when we went back and we checked with the advocates and say, advocates, this is the idea we have. Do you think that this is a real need based on your work? And then they checked also and they said, nope, it's actually legal services. So I think it's really and truly instilling from the very beginning that this is our program. And this is something that we create. And so it isn't to say that we're going to take everything into account or we're going to do everything that said, because there are restrictions and everything, but really kind of making sure that we give ownership to the community. And I saw your hand was up, so I'm not sure if I answered your question. Sorry, Paul.
Yes, pretty much. Just the one thing I kind of forgot to put in the original question is we always have these pressures for the daily work which is in front of us. So in other words, the work that we think is our job. So I guess I'm interested in if is there any way in which you specifically make time for that listening and feedback process so that it doesn't just get lost in the shuffle of, oh, I got to do my case notes. Yeah.
Oh, no, definitely. So I think that one of the primary things is that, so our programming, and it's changed a little bit because of COVID, but we started slowly resuming in-person groups. But one of the things is that our programming would take place on Wednesday nights. And then on Thursday, all the team members and then any volunteers whose schedule allowed it, we would have a weekly meeting. And so that would really provide the opportunity. There was a lot of benefits. There's also some drawbacks because it was a long meeting. So I want to be very transparent in terms of, not everything was hunky-dory. But it not only allowed team members to really kind of bring up any kind of concerns, but be able to get that viewpoint from different people as they were kind of talking about the situations that families were going through or feedback that we had received. And then all of us would kind of discuss and then figure out what was the best way to proceed. And so I think that although it was a time consuming, we have advocates who've been doing this for 30 years, who've been with us since the very beginning. Our original participant in our EPIC program is one of the facilitators. And again, I think part of the reason is that they never felt like they were alone, that it was just kind of incorporated into the work and the expectations of, okay, each week we're going to have that meeting. And so I think it was definitely making sure that we were providing the support to each other and carving out that time on a weekly basis for all of us to get together. Other questions? So I think that, so again, related to that, I think another thing that really made a difference for us was the fact in which the way that we were viewed. And so again, because we worked with the entire family, we basically, so I'm sorry for a second, I got distracted for 1 second. So in the first 11 years that we had our EPIC program, we did not charge anything. We just did community service hours because again, we never wanted to take food away from families. And we knew that for the majority of our participants, they were low income on very limited income and budgets. And so as a result, we didn't want to take anything away. Well, unfortunately, we were also a nonprofit, and this resulted in us almost having to close our doors because we weren't bringing in enough revenue. And so on June 1st of 2006, we changed our program structure where we started charging classes. And at that time, when we explained to our EPIC participants, so again, always being kind of like we're in this together, we explained to our EPIC participants about why we were going to start charging. And we were very frank. Hey, listen, we need to keep our doors open. And we made it very clear that for anybody who had entered the program prior to June 1st, they would not be required to pay for classes. And what was absolutely amazing was that next Wednesday, men started paying, men who were not required to. And we had a soda machine at that time. And I remember there was one guy who brought in case after case after case of soda, and we were just shocked. And when we asked why, they said, we spend money going out to clubs, we spend money at the bars. Why would we not spend something that's beneficial to our family? And so again, it was a way in which they were seeing us, where because we were treating them while we were holding them accountable on group, we were also treating them with respect. And so as a result, they felt like this was a safe place for them. And especially for those whose partner and or children were also attending, they started seeing the differences in their family, where again, because it felt like a community program, the kids would be excited. They would just call it class. They would sometimes urge their parents to go do it. And so as a result, what the men said is, if we spend money going out to clubs or bars, why would we not spend money on something that's beneficial to our family? And so again, I think about being a part of the community, and that issue of respect really made a big difference in terms of the way in which we were seen, the way in which we were viewed, and the fact that after in the state of Georgia, all EPIC programs are required to be 24 sessions. And so as a result, after the men would complete the 24 sessions, we would invite them to continue at no charge. And so again, it was this open enrollment, and basically people could come in for a tune-up, for lack of better words. Another one was being able to develop meaningful partnerships with the victim advocate organizations. And so this one, I will again be completely transparent. We have been very, very, very spoiled over the years because we have everything in-house. So we can literally, back pre-pandemic, we could go next door and the EPIC participant could check in with one of the advocates and be able to see about what specifically was going on. And we also had these team meetings. But at the same time, those relationships and really understanding the value and the importance of collaborating with the survivor advocate organizations, it makes a big difference in terms of helping to increase the safety and well-being of the families. And at the same time, we also are very respectful of survivors who are like, I don't want anything to do with you guys. So again, we always reach out. Anytime somebody, EPIC participant is enrolled, we reach out to their partner or whoever they use violence against, and we'll let them know about our services and that we're here and everything. And there are some partners who basically have no desire at all to tell us anything. So we're also very aware of that. But anytime you can have a meaningful partnership with the victim advocate organizations, it really makes a big difference in terms of being of having a clear picture about what's going on and having a more meaningful impact with the families. Also, always finding ways to avoid working in silos. So this was something in which I had just mentioned in terms of the weekly groups. And so I think that, I'm sorry, the weekly team meetings. And so this really allowed us to have a much clearer idea about what was going on, being able to see the realities. And also it allowed us where we had created this thermometer that had been created by the survivors, and it was to assess their safety. And so what it allowed is that for families where both partners were attending our program, we would have them basically just fill out this thermometer, and it would just say how safe they felt. So if it was a survivor asking her, how safe do you feel today? If it was the individual who used violence, it was asking him, how safe do you think your partner feels? And so this very, very simple evaluation, we would be able to kind of connect it. And it was not validly reliable, all the special things that basically you need to be like evidence-based and all that kind of program. But it immediately would serve as a guide to let us know about how each person was assessing their safety. And so if a survivor was saying that their perceived level of safety was here, and the aggressor was putting it up here, then that basically provides the opportunity for us to have a much clearer idea about we need to check in. There is something going on where there's a disconnect in terms of it, or being able to better address it. And so again, the more that you're able to check in, because again, these are all families. And regardless of whether or not of how long they're in the program or anything like that, they're still going to be together, especially for those that have children. If you have children, even if you break up, they're still going to be being alive. And so that's why we wanted to make sure that we were able to give the tools and the resources. Questions?
Just FYI, Jessica, we're at 12:13 right now, so that's 7 minutes until lunch. And there's a few in the chat.
Oh,
you want to take
I
a
did
look.
not even see the chat. Okay, let me see. Okay. Hold on. Oh, thank you, Karen. I just saw your compliment. Oh, thank you. So Trisha's question, do you typically have male and female co-facilitators? So what we have always done is that, and again, this is a work in progress and going back to ongoing, evolving, and just checking in about our own assumptions. So we've always had male facilitators, and then we have had female facilitators. And so, but the female facilitators, and they refer to themselves as this. So Julia Padilla, who was a co-facilitator for many years, she also proudly wore the grandma or the abuela card. And so she knew for a fact that when she was facilitating, that basically she was seen in a different way versus a younger female in the group. And so we were always very cautious about having younger female facilitators. And this is something that, again, now we're looking into to see about whether or not we need to really continue to evolve. Because from one side, we wanted to make sure that for our participants, they were focusing on like being authentic, being honest about their use of violence versus potentially flirting with a younger female or anything like that. But again, that's making a lot of assumptions. And so we've always done both males and then older females, but right now we're really looking at kind of changing those assumptions, because we also, on our survivor programming side, we just hired our first survivor advocate who is a male, and making sure. And so again, I think it's a reality of the evolving demographics of the community, the idea about equity and going away from gender norms, and making sure that we're continuously working on ourselves. Other questions? So I would say that the other little things that we do in order to really ensure, so again, from a culturally, as a culturally specific organization, we're very careful in terms of different things. And again, this is not only specific to us or our community, or really just culturally specific. So one, literacy. So anytime during the interview process, we have always read the documents, because knowing for a fact that, again, especially when we first started, we were dealing with a lot of immigrants who may not have had the opportunity to go to our to participate in a lot of formal education. But again, we never wanted to make people feel embarrassed or anything like that. So we always made sure that basically we would read the materials instead of just assuming that they knew it and how to read. We would put it in simple terms also, all our materials. There was no big words or anything like that, because again, this is a community program. And it went back to the thermometer and why we use the thermometer, because regardless of your literacy level, whether or not you were a survivor, whether or not you were aggressor, that basically it was something that was very easy to use and to understand, because it was literally just asking people to do this. Again, always looking at the entire situation. So, or the reality for the families. And so this again was part of the reason why we structured our programming, where everything took place at one time. So that way, instead of basically having the dad go one night and then the mom may go another night, and then maybe the kids would get something, and especially in this day and age where gas is so ridiculously expensive, it made more sense. Let's just have them go to one place at one time, also for scheduling, because again, they have lives, so there's practice, there's jobs, there's all sorts of different factors. Also, the reality of the fact that there were some families who were driving without licenses. And so we did not want to increase their risk by having them drive multiple times. And so again, any and everything that we do, we really and truly try to take into the realities of the community in which we're working. And so again, if you look at the Latino community here in Atlanta, it's very different than the Latino community up in Minnesota, for example, that has had much more of a multi-generational presence. And so I would say that if you're really looking to create sustainable change and to have ongoing continued engagement, then see the people, and especially the EFIT participants, as a whole person and not just an aggressor, because then you're going to have a lot more buy-in, and they're going to start seeing the program as something that's beneficial to the family versus a punishment to them. And with that, I think I leave you guys with 1 whole minute.